Welcome back, everyone. It's time for our Fox Hometown Expert, and today we're having a little bit of girl talk, so ladies, listen up. Here's Alana. All right, ladies, we need to chit-chat a little bit. It's time for some girl talk. Well, as we all know, come January, it's Cervical Health Awareness Month, and if you didn't know, we're here to fill you in. Actually, here to tell you much more about it and about, well, women exams. We're talking to Dr. Camilo Gonima. How are you?
Fine, thank you.
Okay, so talk to us about these women exams and how important they are.
Well, in women's health, we recommend that women come in and have their well woman exam every year. And now starting off the year, we think it's a good time to talk about it. Most women should first come in when they're age 13 to 15 for a conversation with their physician, not necessarily to have an exam, but to think about their future women's health. And then after that, starting around age 18 every year.
Okay, and like I mentioned before, January is Cervical Health Awareness Month, and this is something you'd also like to touch on.
A very important part of women's health is cervical cancer screening. Through the developments in the last 100 years, we were able to reduce the incidence of cervical cancer, and especially cervical cancer deaths, significantly.
Wow.
From through HPV testing, the PAP testing, and now with HPV vaccination. It's gotten to the point where we've decided that not everybody needs to have, or not every woman needs to have, a PAP test every year. That's brought up some confusion about whether or not it's important to come in for your well woman exam. And we do believe that it's important in terms of health screening, screening for breast cancer, family planning, and screening for other diseases according to a woman's age and other risk factors.
I see. Well, I was a little confused on the difference between HPV and cervical cancer because they're kind of similar. But of course they're different. So tell us about the difference of the two.
They're very closely related. Cervical cancer, of course, is a cancer, an abnormal growth arising from the cervix, which is the opening of the uterus. HPV is what has been found to cause cervical cancer. Most cervical cancers are caused by HPV. There are a few very rare kinds that are not. However, we found that by screening for HPV, we were able to identify most women who would be at risk for cervical cancer, and then continue screening those women for precancerous cells, while women who are negative for HPV may have fewer cervical cancer tests like the PAP test.
Well, you gave us a lot of great information right here, and I think a lot of information that we all need to know, and that you've informed me a lot also. But if the our viewers at home could gain one thing from our talk today, what would it be?
Continue going to your annual well woman exam. Talk with your doctor whether cervical cancer screening is right for you, and especially think about HPV testing and HPV vaccination in women ages 9 to 26.
All right, well, thank you so much for talking with us. And if you would like more information or to get a hold of one of the wonderful doctors at the Institute for Women's Health, they are on 7950 Floyd Curl Drive. The phone number is 210-615-8585. There's their website, ifwh.org. They're also on Facebook, and they're on Twitter.